wound need oxygen to heal. So it doesn't matter what kind of treatment or ointment or anything you put on the wound. If there's not enough oxygen going to those tissues, it's going to take longer for them to heal. And the longer a wound is open, the chances are of the wound getting infected. In today's video, I want to talk to our friends and family that are diabetic. I want to talk about skin issues, any wounds they might have, how to better take care of it. And if they don't have any wounds, how to prevent them from getting any wounds. So come on in and let's have a discussion. Hi everyone, my name is Anastasia and welcome to my channel. If you've been here before, thank you so much for coming back. If you're new, come on in, make yourself at home. Here we talk about everything. I want to talk about 3 things that prevents wounds from healing. And the first one is poor circulation. So when you constantly have high blood glucose level, your blood vessels are damaged in the inside. And so it can either be completely blocked, which we call an occlusion, or it could be, area like you might have some blockage here, it opens up, blockage here, opens up. So you're not getting good blood flow as you should. And that's called stenosis. And our bodies need oxygen, and the blood is what carries oxygen from every area of the body from the head to the toe. So especially in areas in the legs and in the feet where there are wounds, if you're not getting enough blood flow to those areas, then it's just going to take longer for the wound to heal, because the wound need oxygen to heal. So it doesn't matter what kind of treatment or ointment or anything you put on the wound. If there's not enough oxygen going to those tissues, it's going to take longer for them to heal. And the longer a wound is open, the longer the chances are of the wound getting infected. And then that becomes a whole cycle, and you don't want to deal with anything like that. So poor blood circulation is one of the main issues that prevents wound from healing. The next thing that I want to talk about is nerve damage. So same thing apply. When you constantly have high blood glucose levels, it damages the ends of your nerves. So we call this neuropathy, and it shows up in sometimes having a tingling sensation in your hands and in your feet, pins and needles sensation, numbness in your hands and feet. And the numbness is actually one of the most problematic ones, because somebody can touch, a hot stove or hot plate, and because they have numbness in their hands, they're not able to feel that they actually hurt themselves. Or if somebody has the same numbness in their feet, they might step on a sharp object on the floor, cut themselves, and not even be aware that they cut themselves. So when they're not aware that they have wounds, they don't take care of it, and it just festers and becomes bigger than it really should have been. So sometimes it's not because people are just neglecting themselves, it's because they're not even aware that they have the wounds or they have the problem. So I will say, first thing, if you notice that you're getting any of these sensations like, numbness, tingling, or not feeling anything in your hands and in your feet, seek help, go to your doctor, tell them what the symptoms are, have them check it out, because it might not be anything, but you don't want to be home and think it's nothing and then later find out that it's something. So seek help, because I know sometimes it's hard for us to seek help because we think everything is nothing. So seek help. And then next thing is that for our diabetic patients, wearing proper shoes and fitted shoes is important. You don't want to wear too tight of a shoe, because that can cut circulation. And then you don't want to wear something that's too loose, because you might fall if your shoes don't fit properly. So wearing nice fitted shoes that protect your toes and your feet from any cuts or, running into something and hurting yourself is very important. And they actually have diabetic socks they sell now. So something that's very snug. Even when you're home, make sure you're wearing a slipper, because you never know what's on the floor, especially with kids at home. They might drop something and you're not even aware that there's something on the floor. So always wear a slipper in the house to protect your feet. And another thing is also When you wake up in the morning, even if you think you don't have a wound, especially with neuropathy patients, even if you think you don't have a wound, when you wake up every single morning, use a mirror, put a mirror down and hover your feet on it. Look at the mirror to make sure there's nothing under your feet, to make sure you don't have any new cuts or anything like that, because you might not even be aware that you cut yourself the night before and it just festers and becomes something bigger than it should. So don't ignore any cuts, any bruises, any blisters, anything like that. If you see it, make sure you take care of it to get it to heal as fast as possible, because the longer you wait, the longer it will just become something bigger. And also, if you end up cutting yourself or hurting yourself and you have a wound, make sure you're taking care of it every day. Proper wound cleansing, proper wound dressing is very important. Making sure you're cleaning it very well, not just the wound, but also around the wound. Make sure you're cleaning the wound, throw away, whatever gauze you use to clean the wound, get another one and wipe the around the wound, because if there are bacteria around the wound, it's just easier for them to get into the wound bed and infect it. So make sure you're cleaning it properly. And don't use alcohol to clean your wound. Don't use hydrogen peroxide to clean your wound. There are a lot of great products in the pharmacy for wound cleansers. So make sure you get something that's actually labeled to be used to clean a wound. Maybe in an emergency situation where you just cut yourself and the only thing you have available is peroxide. Sure, for one-time use, you can use it, but it's not good to use hydrogen peroxide as your daily wound cleanser, because what it does is it actually kills, or for lack of a better word, it fries the wound bed. So it kills the good healthy tissue. And if you have a wound, you want good healthy tissue to come in so the wound can heal from the inside out. And also, don't leave your wound and say, "Oh, I'm going to leave it open so the air will dry it out." You don't want to dry out a wound. Wounds actually like moisture, so you want to cover it. Make sure you're covering it properly so that moisture will help the wound heal from the inside out. And leaving a wound open, also you're leaving yourself to be at risk for infection, because when the wound is open, anything can fly in it and just make it worse. So covering your wound, make sure you're cleaning it properly every day, following whatever, if you do go to a wound care provider, making sure you're following whatever orders they've given you. Don't just, say, "Oh, these people, they just charge and they don't, you just want to do things your own way." No, sometimes our traditional way is better. I agree. But other times too, you need a professional to look at something and give you their professional opinion so you can, make things better and make life easier for yourself. And then the third thing I want to talk about is having, a weak immune system. Constantly having a high blood glucose level weakens your immune system, and that makes it hard for your body to fight infection, help any wound heal. So eating healthy, following a proper diet, not just any fat diet, but something healthy that you can maintain in the long run. Obviously, your leafy vegetables, fruits, the healthy stuff, exercising, making sure you're doing things that will boost your immune system. That way, if an infection comes along or if you end up with a wound or anything like that, your body is ready to fight it. If you have any questions regarding wound or taking care of your skin, leave it down in the comments. I will be more than happy to answer them. Thank you guys so much for watching as always, and I will talk to you soon. Bye.